All right, everybody, welcome back to another edition of the Bulletproof Dental Practice Podcast. Today, we're excited to have Steve Rasner again. Steve, by the way, you're the only person who's been on twice now.
Well, I'm flattered, honored.
Steve is, we were just saying before we hit record how Steve was very influential in my career as an associate, listening to him talk about the hope and prosperity of ownership and really just the great things that dentistry has to offer. And it was really the impetus for that changed me to going out on my own. And we were kind of talking about that, reminiscing. I can remember sitting in a lecture hall or a conference. I don't even remember what the conference was, in Florida with my girlfriend, thinking like, not really inspired. And then you came on stage and I was like, holy shit, who was that guy? So, and that was, literally 20 years ago. So, you've done a lot for dentistry, man. You have a great story. I think the most compelling thing about your story that resonated with me is that where you practice. People always give the doom and gloom, and I can't do that in my town, and it doesn't have the demographics, and you totally put that on its head.
I wish, I'm doing this from my office, and I've never done a podcast from my office. I wish you could jump out of wherever you're at right now. I'm talking to your audience. And get in my car and just drive 5 minutes, because you won't believe what you would see. I mean, I'm not happy that I'm in a geographic part of the United States that's economically flat and challenged for the last 37 years. And that's how long I've been a dentist. But it's true. It's flat out it's beyond belief. I've said this on other podcasts. It was the second worst place to live, according to USA Today, I guess about 7 years ago. I'm sure it hasn't changed. It's just, many of you probably have the same story. A big factory in your town closes, and, in the beginning, you hope another factory will take it over, but that's not what happens. And then a lot of businesses that were dependent on those people that earn money from that factory, and that's exactly what happened. It was called Owens, Illinois. It was a gigantic glass factory, and it closed the year after I opened. That's the truth.
God.
And then, it took up like 5 city blocks, not that we have a city. We were told Budweiser's going to take it over, or this. It's 37 years ago. It never happened. And so,
so tell us a little bit about, given what you just said, like your numbers though are quite the contrary for your practice. Like you turn a dime into a dollar. Literally, you've been a hustler and found, you've increased your skill set to do more procedures for people. You've just done amazing things in a depressed economy, like you said, or a depressed city that has a depressed economy.
Well,
but you know what I'm trying to say.
You got to remember something. I didn't plan or know 30 some years ago that if I didn't have a set road, I just took a road.
Mm-hmm.
And it seemed like the right road, the road I trained myself to be better, because as it's famously known in my lectures, I always tell in my lectures how hard I worked in dental school, and that it paid off 4 years later, because I was ranked number 1, and I pause and I say 157. In other words, I was ranked 157 in my class. And I'm telling you that. And I worked my butt off. It wasn't like I was partying. That was hard.
Uh-huh.
And I came out and had very serious self-esteem problems as a dentist. The reason I trained was not because I knew it would pay me off today. I trained because I wanted to feel better about me as a doctor.
Yeah.
And I'm going to talk about that as we roll into this. But listen, bottom line is this. We all have challenges. One of my challenges is that I happen to open up in a town that I grew up in. Why'd I do that? Because I couldn't get in any post-grad programs because I didn't have great grades. That's why. So I go back to my hometown.
That town is what? Bridgeton,
New Jersey.
Yeah, I did the 5-minute drive while you were talking on Google Maps. Drove past the Highway 77 motel, which is across the street. Is it vacant still?
Yeah, it's vacant.
Because I would like That's a pretty cool motel, Peter. You may want to check it out.
Maybe want to take the family instead of go for a
Although
vacation.
it's abandoned, but to substantiate what he's saying, right across the street from his office is a very large parcel, probably like 5-6 acres of a motel that's completely vacant. So it paints the picture.
Beyond what anybody would believe. I mean,
and aren't you fee for service too?
Yeah, I'm a fee for service guy. So follow this.
Okay.
I'm a fee for service guy for the whole time. Never went off the track.
Okay.
I am now surrounded. Now, when I started in '80, there was a lot of fee for service guys and quite a few good dentists. So now I am surrounded by no one else has a fee for, literally, no one has a fee for service practice in this community area. And there's 3 towns. There's Bridgeton, Millville, Vineland. And there are, I don't know, maybe 35,000 people in each community. And it's spread out over about a 20-mile radius. No one in any of those 3 towns has a fee for service.
Wow.
Surrounded by large corporate, and I'm not anti-corporate, but are we okay on the connection?
Yeah, it was pinging there for a second. It was doing something odd. Maybe.
So that's where I'm at, and yet I will tell you that last year, and like I say this with complete humility to my colleagues, because I'm from that town. So I'm not from Beverly Hills or New York or Chicago. I'm from that little hick town that still exists. Last year we did 4.4 million.
Holy shit.
And
how many doctors?
Just him.
I have one doctor that works 3 days a week with me. And me.
Wait, you have one doctor 3 days a week with you?
Yeah.
So yeah.
Me, I work 4 days. She works 3 days. And I have 4 hygienists. I don't know how many days they work. But I think that the real thing for your viewers to grasp is this. I wish you could see, I just pulled up a schedule here I swear I didn't plan this, but I didn't. I just happened to be on my desk, which I guess it's cool lecturing from your desk.
Serendipity.
But, I'm doing, I'll tell you what, I had a new patient come in today. That's right. And that's the cool thing I want you guys to know. This is for your audience right now, right? I'm not just talking to you.
This is for the audience.
Okay, good. So, I had 2 new patients today. It's a true story. So what's one of my keys? One of my keys is I do a comprehensive exam. Let me define that in a few minutes. On everybody that comes in here. And they know they're getting that before they come in here. Now, that is not to be confused with the 45-minute TMJ muscle exercise, and I'm going to relax them and try to find centric occlusion versus centric relation. I'm not even talking that. I have a lot of respect for Dawson. I took all of his courses. I took everybody's courses.
Yeah.
That's really what I did. I went out to Frank Spears. I don't know if this is on the last video or not, but I went out to Spears from Philadelphia 21 times.
Jeez.
It's $5,000 a pop. 21 times, not to mention the travel involved. That's how much CE I took. And I'm going to CE tomorrow after work, down to Pecos in Florida. Because a lot of, I don't know where my audience's journey is going to take them, and I'm going to make some recommendations for you. But my journey went from heavy-duty, restorative, aesthetic rehabs to a lot of surgery being encompassed in that. Mm-hmm. A lot of implant surgery, periodontal procedures together. And the cool thing about that, and many of you know that I strongly advocate oral sedation as a way to expand your practice very rapidly. Mm-hmm. I mean, I don't know anything else that can do it faster than that. But if you're going to do that, then you have to know how to take out teeth. And if you know how to take out teeth, I don't know why. And when I say know how to take teeth out, I mean I'm not even talking third molars, by the way. I'm talking broken down molars, a full dentition. because you can't bring them into your office, talk them into sedation, which is a wonderful thing to talk them into, and send them to the oral surgeon or endodontist or wherever. It doesn't make any sense. They want to come to you because most of these patients have had failed attempts to get themselves in a position where they can relax and have dentistry done. You know, I also have an IV station available here, but I will tell you that's not a way to blow up your practice in a good way. Oral sedation is. And I don't want to be all over the map, Peter.
Okay.
But I'm just going with stream of consciousness.
No, I agree. I mean, I agree with you.
But why not IV sedation? What was the point of why?
Well, because you can market the crap out of oral sedation, but you can't really market the crap out of IV sedation because a lot of people are scared from it. A lot of people automatically associate they won't be able to handle the cost of it, et cetera. So let me talk about that real quick. Is this appropriate time?
Yeah, go.
Because I'm really not doing the 6 things yet.
No, I know.
I'm taking a piece of it that's in there, and I'll say this. Let me back up. Of all the skills you guys can learn, so let's talk about those skills. Why not go out and put a heck of a lot of time immediately into occlusion? Well, that'll make you a hell of a dentist. It's a great way to be and I think you should at some point in your journey, early in your journey, you got to know some things about occlusion.
Yep,
but that's not going to make your phone blow up. No way. Nobody cares, or very few people care, that you can palpate their lateral pterygoids or whatever pterygoid you're.
Yeah, agreed. Yeah.
Okay.
It doesn't make the phone ring, and it doesn't translate to the bottom line. I get it, but you need to know it, right? It's a platform, but you
need to know it if you're doing major reconstruction, and look, you can be the specialist of that if that's what does it for you. I'm just saying that's not a way for a young guy today coming out of a dental school with an enormous amount of debt to get out of debt, because you're going to have a lot of frustrated patients unless you are Mark Piper, Pete Dawson's partner or whoever he was.
Okay.
Hey, I went through all Pete Dawson stuff, and I had a very good friend, a great looking guy. We'll go back to he drank the Kool-Aid so heavy that he went back to Michigan. He said, I'm going to have a CO equals CR practice. Centric occlusion. I'm going to get everybody in centrulation.
Right.
And we're all going to have these consultations. And he had everything going for him. This guy was great looking, great personality, smart dentist, and he went bankrupt. He literally went bankrupt. That's nothing I would just make up. He was my friend, a true story. So I don't think that's the greatest way. I think it's an important part of your fundamentals. Okay. What about aesthetics? You can't even blow up your phone anymore. When I say blow up your phone, I mean a noticeable, palpable, wow, I'm getting a lot of new patients from this. That's what I'm talking about. That doesn't even happen with aesthetics. Do you have to know aesthetics? Of course you do. And you have to invest in Spear out in Phoenix. You got a great institute out there. What about 6-month ortho? Another good thing to learn. Even endo. They're all good to learn, but none of them. Nobody's going to go back. What are you going to say about endo? That you're the best root canal guy in the community?
Yeah. Get me out of pain. Get me out of pain. That's all I care about.
Put that in the paper. As soon as people see root canal, it freaks them out. But I will tell you what it is. It's oral sedation. It's because, and the cocktail that I use, which at the end I'm going to give contact information, and I want your people to reach out to me, which they've done before, and I will give the full protocol, the Rasner full protocol on exactly what I do. I don't even charge for it, by the way. I wouldn't even recommend you charge. It costs $8. I use Benadryl, Atarax, and Triazolam. And you got to know the combination, how many milligrams, and I'll tell you all that.
Okay.
Work for 4 hours. It's 99% foolproof, meaning in 90 minutes, they're snoring. I mean, they're snoring. I don't care why they came to you, they're gaggers, that the sound, that the smell, it doesn't matter to me. I'm telling you, I can only think of one case in the last 5 years that we went through it, but she wanted to go back and have IV sedation again. Okay, now that's one aspect of it. The second aspect is this. I never owned a red Corvette. But probably if you own one, you see a lot of red Corvette, right? If you own something, you see it. Well, those of you that think that there's not that big of a population of patients out there that want that service, it's because you don't offer it yet. You need to believe me that, and you can market the hell out of it. As soon as you, I have so many amazing ads that are just perfect. I rip their heart out with them. Like the title of the ads will be, I cried, he listened. I mean, I'll send them, Peter, a couple ads.
Okay.
I will.
I've seen some of them. You're right. No, I've seen some of them. I've asked for some of them.
He listened. The dentist, One More Chance was another name of one of them. And all these ads I wrote are like quarter-page ads that you run in free newspapers. And, there's only so much we can get into today. And I don't want your audience to repeat the mistakes that I've made. So, for example, I'm in the violent Bridgeton suburbs, which is 1 hour from Philadelphia.
Congratulations, by the way.
Yeah.
Thank you. Thank you very much. We're very, very happy on this part of the country.
You tell them they won, though, and they don't have to burn your own city down.
Yeah, I know.
These freaks. I don't know. Just a bunch of 20s.
You won.
I know. It's embarrassing. I don't know what to tell you. Where was I?
Well, we were talking about the things we would do. So really, what I and you maybe even mentioned some of these already, Steve, but really the 6 things, you have such experience. And when you said the 6 things that I would do, what did we actually say? The 6 things you would do again.
Let me give you, here's what I said. And I'll give you full disclosure.
Okay.
I wrote an article 20 years ago called Dentistry Today, called 8 Things I Would Do If I Started Over on Monday.
Started over, yeah.
I wrote it 20 years ago. So I was your age. Okay. So 20 years later, I wanted to reinvent it. And I just called it 6 Things I Would Do If I Started Over on Monday. And because we have less time in a podcast, and we could always do half of them today and half another time if they want. So let me talk about them, okay? Now, I don't know if we edit this part out, but can I bring up my notes a little bit, or you see me still or not?
Bring it out. No, we can still see you. It's all right. I mean, hey, this is not formal. Bring it up.
Okay. So I like seeing you guys when I'm talking, so I'm going to put it down here.
Craig is really handsome.
Let's first start.
Craig, what?
I said Craig is really handsome. That's all I said.
This is great. You guys are awesome.
Must have been a long day for Peter. 2 cases, he's seeing double. Just so you know, Dr. Appa prepped 185 teeth probably before you ate lunch today.
Do you know Mike Appa? Steve, you ever heard of him?
I know, but I do, yeah.
He's was Larry Rosenthal's partner. Goes to New York, Dubai. Yeah. And we had on the phone with him last night for a podcast, and literally he preps. What is he? 6 cases a day? Like it's bananas. He's a machine beyond machines. I've never heard of something like this before. He's the real deal. You know what
I'll say about that? I'll say if that works for guys, I hallelujah. It's not going to work for you when you're my age.
Yeah,
or
you wear out.
Maybe in your 50s. My life's beautiful, man. I don't want to keep talking about sedation, but I see about 4 patients a day. Now, those patients are in my chair anywhere from 2 hours to 3 hours, and they can overlap, by the way. Mm-hmm. And I would go bonkers. And you can leave the room. You don't have to be in there 24/7 if you have open rooms like I have. And you know what happens? It gives you an enormous amount of time. You can go into another room and check hygiene, and all of a sudden you got a lot of time because you're very, very productive when your patient's asleep. Mm-hmm. When your mouth is cranked open. It's just beyond belief. But I'm getting off track. I'll come back to that. First, I'm going to tell you my definition of success. And I think it's important. To me, success is living life on your own terms, and working when you want to work, and not working when you don't want to work. Now, I want you to think about what I just said, because it may not mean a lot to you right now, but it's going to mean a lot to you later on.
It does.
Do you ever meet a patient of yours? I know some of you can relate to this. And that son of a gun takes off, I don't know, 8 weeks a year or 6 weeks a year. And you go back in your operatory and you're the old schlepper. You're thinking, God, how does he do that? You know? And the number one reason your colleagues, I'm bringing it back to dentistry right now, the most successful guys in the world there are guys that work later in life on their terms. They're not working to pay the gigantic home, the primary home, the shore house, the $180,000 car, private schools, and everything else. And this first part of my presentation, well, it's not my first part anymore. This part of my presentation, you're not going to love. And it's not sexy, but it's just true. And I didn't follow it. I'm fine anyway, because I have an extraordinary practice and income, but I would not recommend you follow my road. You got to have financial discipline in your first 10 years. You have to. You got to keep your credit scores high and your credit cards low. And I mean it.
Wait, is this number one?
Yeah.
Okay, number one. All right, so it's
number one is financial discipline.
Financial discipline, okay.
And I'll repeat. I know you don't want to hear it. You know, how many of us have the discipline after never having anything in life to not buy that brand new Beamer?
Right when you get out of school.
Me.
Or whatever it is. Not me either.
I did.
And you had the discipline.
You had the financial discipline?
No, I did not have financial discipline.
So is there a part two? If you didn't do it in the first 10 years, what did you have to do in the first 20? I'm outside of 20 already, by the way.
Yeah, well, you got to – here's how you know what you have to do if you're 10 or 20 years out. You got to really, honestly, and I mean this, man, you got to look in the mirror and say, am I living to pay bills? And if you're living to pay bills, you got to sell some stuff. You got to change your lifestyle because you still have time. You still have time in your 40s to change your lifestyle. You know, all those things they say about us, I forget the percentage, but there's a remarkably low percentage of retired dentists that have enough to live on.
Yeah, 95% of dentists cannot retire. The 88 statistic.
95% of dentists cannot retire with enough to sustain them. And
at 65.
65.
Yeah, okay. And I don't know the definition or the right ratios of the amount of bankruptcies there are and all these things. But this is real stuff.
Right.
It's real. And so if you can get that discipline in your first 10 years, and if you can't, you got to reel it in, man, because you still have time. Because you're not going to have time at 60-something to start fixing things. I'm just saying. So the one thing I would invest in early on is yourself, is in CE. So the other thing I want your audience to seek from me, first of all, let me make it easy for you. When I give you the contact information, all you got to do is say, send me the stuff. That's it. And stuff is going to include the sedation protocol I told you about. And by the way, you're writing to my personal email, and I got no agenda. I'm not going to.
Yeah, I'll put it down. I'll put it in the show notes for sure. Yeah.
Okay. You're also going to get my recommended post-dental CE curriculum for 2 years. I'll tell you what I did. I took one course every quarter. I took one continuum every year. That continuum might last a year. That continuum. Now I didn't start taking continuums until about my third or fourth year because they didn't have them. The first continuum I ever took was a perio at Penn. It was like once a month. But I also would send my team to take at least 2 courses a year. So that's what I did. But again, they asked me, because I did a lot of research, and the subjects I would tell you are going to be oral sedation. Well, that's not even hard to do. Most states are going to require 60 hours initially and 20 hours every 2 years. That's what it's going to be. Okay, not all states. And then if you're going to learn that, you want to take atraumatic extractions. And then if you're going to take traumatic extractions, you want to get in early on implant dentistry. And in addition to those, it's restorative stuff with spear and coys and occlusion at some point. That's it.
This is the 2-year out. This is the 2-year out curriculum,
I actually looking at my notes. It's a 4-year blueprint.
4-year, okay.
4 years.
I would agree with that.
And you can start that like 1 or 2 years out maximum. You got to start taking courses. Let me tell you why. It's going to do 2 things. Number 1, it's going to empower you. I'm not talking to you two. I know you two know this. It's going to empower you. You do what you learn. So you're going to go back to your office, and the next time you recommend a certain procedure, you're going to have binded firmly in you all that information you just got from the last course you just took, especially if it's a continuum, meaning, part 1, part 2, part 3. Okay.
Uh-huh.
Number 2, it exposes you to other guys. When I say guys, of course, I mean girls and guys. It exposes you to other dentists. And whether you like it or not, we are isolationists by definition of what we do.
Mm-hmm.
And it's a very easy way to get burned out in dentistry, to not reach out. And you're going to go to a course, and sometimes the best pearl you get is from another guy your age that's at lunch. And you're talking about things that aren't even part of the course.
Yeah.
So education CE is big on my list of things you do. So far I've talked about being financially disciplined. The second thing is I'm telling you to seek out successful mentors. And you know what? They didn't have podcasts when I started in 1980. I don't know when they started, but that's what you're doing right this second. You're seeking out somebody that has a track record. And I would try to seek people out like Peter. Peter's following because he works. He gets it. He knows what you go through. I sure as heck what you go through.
Mm-hmm.
I got the best insurance person I've ever had. Not that I really need one. There's a reason I need an insurance person, because even though we don't participate, I have to get them money that they could have gotten. So I still need. Okay.
Yeah, they're at a network benefit. Yeah.
So just so the audience knows, I live in your world. I have the best one I've ever had who resigned on Monday. See, I live in your world. I can't fix what she resigned for. Somebody offered her old boss, gave her an astronomical offer. And I'm just giving an example. I know what it's like. So seek out successful mentors. And the best way to do that is what I used to do is I would just ask questions from my supply company and other dentists. I remember driving hours to sit in a guy's office for an hour or two. Today you can do it through podcast or other ways. But, I make it a point to have lunch, or not lunch. I don't do lunch. I have dinner about once every 4 months with a guy up here who owns 41 offices. Now, why would I do that? Because that's a very different philosophy than mine. Well, here's some reasons why. So I would find a guy ultra successful. Hopefully he'll be, if you don't find the first attempt, you'll get it on the second or third attempt of another dentist. You'll find somebody that wants to share with you. Because we're by ourselves. How do you know, for example, you're getting the best return value on your lab you're using? Just as one example. Most of us have more than one lab, right? Mm-hmm. You're doing an anterior case, you got a high-end lab, you're doing posterior cases, you don't need to spend $350 a unit for a posterior case. Well, then how do you know? And he turned me on to his lab. And with one dinner, I saved $57,000 the next year by switching the lab. I wouldn't have known.
Yeah.
How do you know without trying them? How does he pay his hygiene? Do you pay him hourly or percentage? You can read all you want, but what about a guy that's doing
it? Yeah.
How do you motivate your team? What kind of advertising are you using? And I'm saying you can't afford to reinvent the wheel on everything you're going to face. You know what I'm going to tell you guys right now? Not you two, the audience. What I advocate is a lot of work. And at some point, you got to ask yourself how bad you want it. How bad do you want success? I mean, that's true for everybody, not just dentists. So I know the stuff I'm asking you to do is laborious. I mean, probably the last thing you feel like doing on your day off on a Friday is driving 2 hours and spend a day in Peter's office or somebody else's office. But anytime you don't want to do it, you got to ask yourself, are you happy where you are, and how bad do you want it?
Mm-hmm.
Okay? Number 3, I would design from the very beginning. If your office is not created yet, or you just started, or you're thinking of doing it next year, or whatever it is, design an office that is conducive to people saying yes when you present treatment plans. And you better believe that that comes from everything, including the first phone call. Let me take you through this. At the end of the day, there's nothing more powerful that you do during a given day. I don't care if you're the second coming of G.D. Black and you invented the veneer prep. Now, the most important thing you got to do is when you have that one-on-one with that new patient and their significant other, because I'm going to ask you to bring them to the initial visit, which I do. I don't get 100% of the time. So, you know what you do want to write down? You want to write down the verbiage that you need when you write to me. Besides send me the stuff, what do you get your new patient coordinator to say on the telephone to get people to A, go out of network and try you, B, to get their significant other to come to the first visit if possible, if they indicate significant need, and 3, how the hell do you say the right stuff to make it be okay to get paid up front? There are the 3 things you need. How to say to get them to go out of network, how to get paid up front, and how to get the significant other. They all kind of go together. So when that patient is coming through my front door for the first time, they're already in the process because they've been talking to somebody that's been trained by me over many, many years to bond with people naturally. I couldn't do it because I don't have the patience. She does. And when I go by her desk and hear her talking to the new patient that called, I think she's talking to an old friend. I do, or a relative. And I don't know that I could do that. I can do chairside.
Right.
But I couldn't do it
on the phone day in, day out. Yeah.
And then when they walk in the office, and I don't mean you have to be opulent. It's nice. If you can afford that, that's great. But you don't have to have waterfalls flowing in your waiting room.
Pete does.
Well, Pete's a superstar.
Oh.
And, he's got it all going.
Thank you. Well,
I'm talking about the average guy like me. You got to be clean. Here's what it's got to be. Warm and hospitable and inviting. And that, you don't have that talent, and I don't know that you want to hire your wife to do the waiting room. That's one place I would get a decorator and say I want it to be warm and inviting. Mine's not fancy, but it's warm and inviting. It's always clean. I got a little area. I got a computer. I have a little area where they have all kinds of refreshments. And it's not just that. It's having front desk people that get it. And they get it because you remind them constantly, what you have to do. You constantly have to remind people that is your job of what you expect. And if they're not doing it after you constantly remind them, they need somebody else. So, I mean, for the lack of a better idea, I can't think right now, call the motor vehicles division of your town and then call the Ritz-Carlton or Four Seasons. And and right here, we are so rural that even if I could afford the office to look like the Four Seasons, it wouldn't work here. People would be scared off here. I'm not kidding. But my people get it. I mean, I listen to them, and I love how they emulate the philosophy that I'm talking about. You know what the philosophy is? When I lecture these days, Pete and Craig, I talk about the Cheers atmosphere. Bar Cheers up in New England. Yeah. Everybody knows your name. Yeah, that's what it is, man. And they're real. It's warm and inviting. Hey, you must be Mr. Jeffries. We've been waiting for you. Welcome to the office. I hear it. Hey, let me get some paperwork. Have you done that already? Obviously, there's a lot more that goes into it than this. But, they're not in my waiting reception room for 20 minutes. And the next person that picks them up from the reception room gets it, meaning there's a lot of smiling going on. Look, you got one chance. It's this time.
Agreed.
It's this visit. First of all, it's nice to be nice. It doesn't cost, it's not laborious to be nice. It's not arduous. It's fun, and it all is so worth it when the patients say, wow, I love this place. And they've only been there like 30 minutes.
Yeah.
I'm sure you guys can relate. And there's a pattern to it. It's organized. They come out of the reception room. They go into an operatory. They're not sitting there for 15 idle minutes. And someone introduces themselves and the x-rays are taken. And there's no objections to this stuff because this stuff's all been laid out over the telephone in a very patient-friendly way from the first phone call. So I don't get the hygienist walking back to me like I have in my career saying, hey, they won't let me take any x-rays. That never happens to me because it's happened to me years ago, and I have a protocol. I have protocols, meaning what to do when.
Yeah. And
that includes a new patient phone call. And that's where that comes in. It never happens. I never have anybody say, they don't want their whole mouth examined. They just want this one tooth out. I did in my career, but I don't anymore. So keep in mind that everything counts at this initial moment they're coming in, especially the tone of voice people use, your people are using. Are they smiling? Do they really like people? Look, I'm not being like rah-rah here and talking about stuff that can't be done. We've all been in a physician's office who could give a crap about that, most of them. And lady on the phone tells you to sit down, hand you a paperwork, and you go from station to station to station. Well,
slide the door back, right? The sliding glass door.
Station one to station. Well, remember how we started this podcast today? I talked about being in a very challenged area of America, and yet I've had this practice for at least 10 years. It's done $4 million a year, and for 29 consecutive years, from 1980 to whenever 29 years later was, I can't think right now.
2009.
Yeah, we never had a down year. That was 4 recessions.
Whoa.
Never had a down year. Maybe I only went up by a couple $1,000 some years, but I never went down. I did for 3 years after that when I guess it was in 2009. Mm-hmm. But I'm being honest, as I always
everybody did.
But that was the first time. It didn't hit me that time. And these are the reasons why. These are the reasons why. So I always say this, and I'm reading part of this, but it's okay. That I like to say to my doctors, nobody's going to benefit more from your success than you. If you go up $1 million in the next 4 years because of this podcast, I won $10,000. No, that's not what I was saying. I was saying if you go up $1 million from this advice or other advice, you're not going to split the profits equally with your team, nor should you. Nobody would expect you to. You're going to make the most by far, as you should. And God forbid one of you listening goes to the tank and you can't make it. Guess who's not loaning you money? Your team, nor should they. So you have the most to gain. Why am I telling you that? Because when you feel sorry for yourself that you have to constantly remind people, which I do on Monday mornings, like, let me give you some examples because I wrote them down. Is it okay? Am I going too long? I'm going too long.
You're good. Right? You're good.
Okay. Like about a couple years ago, I noticed that we had a lot of patients that had scan and root planing one time in their career and never again. And yet all the statistics show people never maintain that, mostly don't maintain that level.
Right.
So why? And all I want to do is not be, I don't even have production charts in my office, by the way, production goals. I mean, there's a million ways to be successful. I'm simply telling you, I don't have that stuff. What I do I have? Constant verbiage from me telling people what I expect that work for me. Are we okay? Are we unstable?
No, we're good.
I see. You good? Okay.
Yeah.
So this is what I did. I implemented a new protocol where the hygienist had to go through their schedules the day before their schedule to see the history of scaling and root planing. So they were prepared the next day. Now, all I wanted them to do was the truth, to do diligence. Is that patient needed again? Mm-hmm. Right? Or are they okay? I wanted them to be that kind of hygienist. I also needed them before that next day to give that information. Let's say there was 2 people out of 8 on their schedule that had history of scale and root plating and needed that to go to insurance so they'd be able to tell people their out-of-pocket expenses. Because this is what happens. And what happened from that, long story short, if nothing else happened, it made my hygiene team understand that it was not okay with me to send people away with inflamed tissue, and we'll check it next time. And if you're not better, we're going to have to recommend treatment. Why are you sending them away? That's just one aspect of what I did. You know, telling my front desk team with an email on Mondays to remind them to get copies of the driver's license, cell phone numbers, and emails so we can communicate with them like we have to in 2018. That didn't matter 20 years ago, but I have to do that. I'm being honest with you. Mm-hmm. And so super successful offices keep systems or have systems that don't end up in your closet 3 months later because the boss gave up. That's why you do these things I'm telling you do. And you know what? After you keep doing them, they become habit with some of your staff. Now, and I'm not here to imply staffs are terrible. I've been doing it for 37 years, and I have a great friggin' team. My observations is that you constantly have to remind people why we're doing what we're doing and what do we stand for. And the number one thing I want to stand for above everything else is to be a thorough, comprehensive dentist that tells the truth. That's all. So the next one I have.
What number are we on?
4.
4.
Yeah, you don't have to.
I'm wanting to make sure we get to this. I know we don't. I don't want to take it longer than an hour. But okay. You've got awesome stuff, but I want to make sure we're bookmarking these because I want to write these down in the notes. So here's I'm going to do some of them quick. I'm saying you have to embrace number 4, the concept of be willing to do meetings, and I get it, man. I used to have no problem. Willing to do meetings with what? With whom?
With your staff, with your team.
Oh, okay. Yeah. It's like morning meetings, right?
You have to have a morning meeting.
Okay.
You have to have a morning meeting. And this is a hard concept for guys.
Sorry to cut you. Pete, do you have a morning meeting?
I do. But I acquired an office who did not do a morning meeting, and it blew me away. I thought everyone did that. And now they do a morning meeting, and it's made quite a difference, quite honestly. It gets everyone aligned for the day. So I am in complete agreement, Steve. I think a morning meeting is paramount. But it's 15 minutes, right? That's how long ours are.
It's not even. It's 10 minutes.
Okay.
And listen, I'm talking to the audience. This is not staged. This is real stuff. I wouldn't waste your time watching a podcast from me on some things I don't do. Everything I've told you in this podcast, I still do. And 37 years into this, I can tell you that somebody wrote something, and I'll send that to you when you say send me the stuff. I'll literally give you what I'm going to abbreviate right now of what you should do in those meetings. I thought I had the best stuff ever that I came up with, but I don't even know who this is. But it's everything I do. It's just more organized. It's an opportunity to know who has an old balance. Okay? I mean, it's a perfect opportunity for you and to verify.
And your team to discuss who has an outstanding, who's coming in today with an outstanding balance. Exactly. Yes, we do that.
Okay. People that are new to your practice, obviously you want to be right on time for everyone, but you better be on time for the new patient. Your waiting room, reception room, better look immaculate. Make sure there's water for the coffee and the refrigerator's stacked, blah, blah, blah. Celebration. Or is anybody coming in today that's got a birthday, anniversary, anything? Are they getting ready to retire? These are not hard things to do if you're looking into them. Special needs. If we have somebody coming in today, I have one lady that makes me put like silk on the head of the chair so she doesn't get chair hair or whatever. I have many people that need wheelchairs. Somebody have a temperamental child. I mean, just list them as any special needs.
We go over outstanding. We also go over like outstanding treatments that's been diagnosed that hasn't been yet enrolled.
Perfect.
Yeah, things like that. Just looking, and then also, Steve, we do a big thing in my practice is same day dentistry. Right, we look for opportunities to really benefit the patient. If they're already here, do they want to knock out that crown? So we look at same day opportunities as well.
Yeah. Well, I will tell you, without ever having this discussion with Pete and Craig, also that I know what successful guys do. And what I'm telling you is not unique to me. And there's probably 5 other things you could add to this.
Yeah.
And of course, you want to be appreciative for people that refer to your practice. And I have a whole system for that. You got to check out your state. But the best mouth of referral I've ever come up with is we give $25 Visa cards if they come in. Now, not every state allows that. My state does. It's friggin' awesome. I spend about $2,000 a month on $25 gift cards.
Damn.
And I experimented with the amount. I'm telling you, I know it. 50 is too much. 10's not enough.
25 is a sweet spot, huh?
It's a sweet spot. The other means that we're not going to go into right now are strategy meetings for the entire office that you're going to maybe go into a different direction. And they're to occur monthly or every 2 weeks. And I know that's hard for you to swallow. I get it. But I will tell you, the first year I ever went from 1 month to every 2 weeks, we went up $700,000. And I was already doing well over $2 million. And the reason is this, and I realize that's a hard thing to ask you to do. And I'll tell you one more caveat to that. I'm almost out of time. You don't have to have the entire staff to do that. I used to do that. So I would pay 18 people, of which 14 of them meant well, but they never gave an idea. They never brought an idea to the table. And I'm talking about ideas that will change cash flow. Maybe one of the things you need to do, for example, is, hey, I heard Rasner on Peter's broadcast. How about us getting paid up front? How do we do that? And I'll tell you what I would do if I was at office. I would write to me, if you haven't done it yet, and I would say, tell me the exact verbiage. Can my girl get on the phone with your front desk girl? What do you got to lose if you don't ask me that? I would do things to improve overhead, right? How can we control, if you just think these things, they're not going to happen. How can we improve our new patient experience? What can we do for the community this year? Let me keep going because I'm almost. Number 5, Pete, is I would embrace my community. So check this out. Why am I telling you this? And 6, it'll take me 1 minute. I'm in a community that struggle. I'm not proud of that. It's just real. So I have people coming in here, and trust me, I can look at them and either they don't care about how they dress, or they just can't afford, or they don't pay for fancy things. Yet I have treatment plans going out of here weekly. Well, you can imagine what it is. It's $90,000 a week collections on 4 days. That's a lot of money. That's out of pocket. Okay, that's not insurance. That's out of their pocket. So that's a lot of money to come up with to spend in a community. So if you ask in this community, my reputation, and I'm here 37 years, I wish it was perfect, but I'm sure a lot of people think I'm expensive. They do. You know why they think I'm expensive? Because I'm comprehensive. Because I don't just patch number 30 with a big amalgam or composite, hope they like me, and I'll come back in a year. There's too much to tell in a 1-hour podcast. But we live in an elective industry, And you better believe when the ether strikes, when there's a moment for them to come to you, that's the moment to look at their whole mouth. I totally don't believe. Now, they get that from me over the initial phone call. Whether they, look, I told you earlier in this podcast, I had 2 new patients today. But in truth, one signed on, he didn't even sign on for it. He needed $600 in fillings. 3 fillings or something, or 4 fillings. And the answer to the question I got was, how necessary are these? None of them are necessary. I just wanted to make money off you. What, are you kidding me? And I think he likes me, but he declined. Mm-hmm. The other one was a $33,000 accepted and paid for treatment plan today. I met her today. Never met her before. Wow. So I'm consistent. I treat everybody the same. I never look at them and think, oh, I'm not going to do this with them. They have bad shoes on. Mm-hmm. I'm not going to do this with them. They have a hole in their. You just never, ever know. And by the way, comprehensive exams are what they're supposed to be. They're good for the patient, whether they do it or not.
Exactly.
The last thing I would tell you to do is this, and I realize this was quick, and this is important. I'd constantly remind myself, why am I doing this? Any of this? To be happy. Am I happy living my life the way I'm doing it? Right? What you don't want to do is run around the country for the next 10 years, taking every CE course you can and abandoning family. And then you're going to be divorced when you're 48 or 50 and lose half of what you're building up now anyway. Not to mention maybe break up with the love of your life when you really didn't have to do that. You got to treatment plan your life too, man, because mm-hmm. things are going to happen to you that you don't know about yet. I had lung cancer. I don't know if you even know this.
Oh,
I never smoked. I got lung cancer in 2000. Bad lung cancer. Like, I'm going to live 2 years lung cancer. Stage 3, N2, non-small cell adenocarcinoma. I got it.
Wow.
I went 29 years in a row, never missed a day of work for being sick. And in 2011, I had back surgery. And I lost a son, too. And the reason I'm telling you all this.
Oh, jeez. I didn't even know all this, Steve.
I've had a pretty good life, but you don't know what's coming. You don't know. Yep. And so it's really important to balance life. And I know Pete probably talks about this and Craig, but you can't just hear it and let it go. Because I know what you want. Everybody listening wants more income for more freedom. But remember how I started this? Live your life on your own terms by controlling your expenses early on. There's a lot of years to live where you can get a really beautiful car or a second home or whatever. It'll be a lot easier for you if you start out ahead of the game and start behind the game. I don't know if that was good, but that's all I got.
No, that's awesome.
And I would agree with that too. Honestly, in hindsight, I got out of dental school and did not abide by that very well because I figured I had suffered enough. I'm going to get out and get me something, right? And and then I had to reel it back in, So I would agree with that. I think that was a problem in hindsight that I wish I would have kept living like a dental student when I was out like a dentist, and it would have.
I know so many dentists that grossed a third of what I grossed, and are living high on the hog because they had $1 million to put into this investment or that investment, and I'm fine because, like yourself. And like a very small percentage of dentists, I built this amazing place that I've got that's covered my mistakes. Okay? But had I not done that, I would have maybe been one of those guys that can't retire. I can retire. I can tell you that.
I think the other thing that happens is, as well as you mentioned the statistic yourself, you said you've never really gone down year over year. So you're making more and more money every year. How many years have you been in practice, Steve?
37.
Okay. So same thing for me, 20 years and every year doing a little bit better. So that's what happens to doctors is we do better every year. So, screw it. We'll spend a little bit more, but you can outspend your income. And you never really win the money game. You make more money, you get a bigger mortgage. You make more money, you get a bigger mortgage in a boat. You make more money, you get a bigger mortgage in a boat and a mobile home. It just kind of goes on and on and on. So it's an important lesson for those that are listening that are younger. They may be looking at you with your $4.5 million practice, or Peter, my practice, saying, well, if I made that, all my financial concerns are taken care of. You've got to stay disciplined. It's so important. The money thing is it'll creep up on you. And if your wife is spending all the money, you got to talk to her as well. I'm very fortunate. My wife, I'm the spender. So my wife could be very humble. But if you have a spouse, a wife or a husband and you're the breadwinner, you got to really have that conversation. You need to have a good financial plan.
The whole essence of your relationship and of life, again, is to be happy. And you'll be a lot happier if your husband or your wife's home instead of working until 10 o'clock every night because they have to, because they can't make payroll.
And that's not what it's about. Like you mentioned that, if your life is revolving around bills, what kind of life is that? Right. And there's zero fulfillment. There's zero fulfillment in that because you're making, you're not being intentional about your life. You're just kind of letting it happen to you and being and reacting. Essentially.
The important thing I don't know if this is going to be in this or not, but the important thing for people to remember is that you can almost, I don't know what to do. If you're watching this and you're 60 and you're $5 million in debt, I probably don't have the answer. I mean, I don't know what to say. But most people.
How about if you're $6.5 million in debt? I have a friend that has that.
Really?
Asking for a friend, he says.
Yeah, I'm asking for a friend.
Okay. Well, what I'm saying to you is, if you don't do that, or if you change your ways early on, how do you change your ways? Don't go out and buy anything else right now unless you can afford it. Just stop doing it. That's a start. There's a lot that goes into it, but look, I obviously am very reachable by your people if they want to reach out to me.
Yeah, well, I will post that. And people have actually commented to me how hey, I sent him an email, he sent me back all the stuff. So thank you.
Yeah, the next day we do. Yeah.
What do you have upcoming, Steve? Like what's going on your radar? I know you teach, you've got a atraumatic extraction course. Is that right? Coming up?
Yeah.
Or does that just happen?
Look, I know it sounds self-serving, but I'm proud to say to you, there's not many places I know of that you can go and without a license in that state and actually work live on patients. And I have that right in New Jersey.
Okay.
Because I went to State Board of Dentistry, and I got the permit, or it's not even a permit, the approval for people to come. And in my next course, if you go on my website, which is realizingthedream.com, the next course is in March, but it's sold out. I only keep it to 8 to 10 guys. That's it.
Yeah.
And it's an amazing course because we talk about this stuff that we're talking about. We even role play because I let them bring their team if they want. They don't bring their whole team. They'll bring 1 or 2 people sometimes. But that's in between you guys working on nonstop for 2 days with me being right by your side, all kinds of surgical extractions, suturing, flaps, grafting, the whole thing. And I even get them numb for you because I don't want you to waste even 5 minutes numbing the patient unless you want me to teach you that too. And you should not feel funny about it. I mean, coming here like you don't have those skills, because my observations are we weren't taught that well enough and most of us don't have those skills. So my next course is in May. They can get the dates, I think, are the 4th and 5th. But it's really worth you checking out if that's, and remember why I'm saying it, because my triad is oral sedation, because you can market it to death, extractions, and then implants. That's it. But thanks for asking.
Cool. That was a lot of information.
It was, man. You're like a dental fire hose. Like you just have so much, and
I feel doused. I don't know about you, but I feel doused. Completely drenched.
You guys are like Mike and Mike on ESPN. You guys are great.
Hey man, you don't need us. We'll just set you up with a mic and you just let it roll, bro.
Steve, you need a podcast. You got too much trapped in that brain.
Yeah, you got to download it, man.
I'm gonna have to ask you how to do it. I've never done one on my own, but I want to.
I don't know how to do it. Ask Peter.
Craig just logs in, and that's all. And he's co-host. Like, oh, what do I have to do? I'm like,
you guys have. I'm not just saying. I don't know if this is gonna be part of the show, but you have beautiful chemistry. You got to keep that.
Thank you.
Nice.
Thank you.
I appreciate it, Pete.
My pleasure, buddy. Good to hear from you. You looking great, it's good to talk to you
I'm
again.
so proud of you, what you've done. You're in a funny way, you're my hero.
Well, oh man, thank you.
Pete,
Thank
you're
you.
my hero too, bro. Seriously, man, you're kicking ass. Keep doing it.
Thanks, guys.
Cool, man.
I'm blushing.
You guys
All
are the
right.
best.
See you
Talk
guys.
to
Thank you, Steve.
Take care.
Thank you.